My name is Marcela Candeias. I live in Portugal, in the south of Portugal, in Alentejo, and I have ABPA. Before I had asthma since 14 years old, but my asthma was all the time controlled. Before I was a very healthy child. At the beginning, asthma was quite complicated, but after we create a balance between the asthma and the medication, so everything was under control. I went to the doctor to see the pulmonologist twice a year. I make all my medication and my inhalers. Everything was okay. I practice sport. I travel abroad. I work. Everything was okay. I only avoiding the allergens, mold, dust, the tobacco smoke, but everything okay. Yes, I understand. At that time I have a chronic disease, but everything it's under control. As I can explain to you, I work. I have my whole life. I have no problems with asthma. I was allergic to mold, dust, tobacco smoke, stress, but everything was okay. In 2020, everything changed, and about 15 days using the mask, the protect mask, I start to coughing. And the symptoms get worse and worse and worse. The symptoms get worse and worse. I don't know what I have. I changed the mask all the time, but it was awful. So between the lockdowns, I managed to have an appointment with the different pulmonologists, and they say all the time, "Oh, you are having an asthma attack." But I don't feel I have an asthma attack because it was very different. Because during the lockdown, me and my husband, we walk, we make many walks. So sometimes we walk for 12 kilometers. So if I had an asthma attack, I was not able to do that. So they don't do any kind of tests. They don't because of the COVID. So I haven't any exams. So and I feel very bad, and I cough 24 hours a day during day and night. It was awful. I start to lose weight. I always felt very tired. My mucus turned from greenish color to black. And I have never shortness of breath or wheezing, but I feel very, very bad, and I cough. In March on 2022, I've decided to have another opinion. So I went to another doctor to see another doctor, a pulmonologist. And when I tell my story live, he said, "Well, I think I know what you have." So we made analysis, CT, and 1 week and a half, I have the results, and my lungs were full of mucus and consolidated mucus, and I have some bronchiectasis. So I was very, very bad. I was in risk of life at that moment. And they said, well, you must come with me because it's very urgent. You make bronchovidoscopy. So after that, after that exam, I spent 2 hours doing the exam, washing my lungs. And I have Aspergillosis and Niger, and the bacteria. And the diagnosis was ABPA. And I asked, well, what is ABPA? I never I never listened about that disease. And I study when I have the diagnosis of asthma. I study many things about respiratory disease. So for me, ABPA, what is that? And because of that, my life turned upside down. So my pulmonologist support me, explain me. He said at the beginning, well, it's a chronic disease. It's not very good, but you can do something. Okay, the first step, it is make voriconazole, prednisone, biweekly tests, but was very difficult because first of all, voriconazole, I have all the side effects of the drugs. I felt very bad, anxiety, fears. It's very, very difficult to deal with the side effects of the prednisone. And when I did the voriconazole, it was in summer. So in summer in Portugal and voriconazole, so it's awful. I put hat, I put sunscreen. I live near the beach, so it was impossible to go to the beach. So for me, physical and psychological was very, very difficult to deal with all of this. I can do the voriconazole during 3 months and a half. So my body reject the drug, but the levels of the analysis are more or less, so we stopped. And it seems everything was under control. But in 2023, I have 3 relapses. So everything started from the beginning. It was necessary doing itraconazole and again prednisone. So it's very, very difficult to manage the disease and the side effects of the drug, the medication. Now I'm taking prednisone since January 2004, and every day is a challenge. I do since August 2004. I start taking the biologic meralizumab, but the problem it is I continue to take prednisone, and I'm intolerant to prednisone. I have all the side effects of the prednisone. I have tremors, sweating, slow face, joint pains, muscle pain, insomnia, depressions, mental confusions, mood swings, headaches, everything you can imagine, I have it. Yes, it's awful. And of course, I'm lawyer. I stopped working since 2022. My tool is the voice. At the beginning, I lost my voice. It's very difficult to deal with the anxiety and with the depression or sometimes the mental confusion because of the prednisone. So that is impossible to deal with my job. Besides, during 2023, sorry, I start work, and after 2 or 3 months, I gave up because of the relapse. And in 2024, it was awful again because in January, last January, I start to do the prednisone, high dosage of prednisone. So it's awful again. I give up working. And what I can do, sometimes my life changed too much. My life, my family life, because I felt frustrated. I felt depressed. I felt anger. At the beginning, was helpful to stay to go to a restaurant because of the noise. I'm always tired. My voice are like this all the time. For example, if I go to court, it's very difficult to project my voice. In the past, I did seminaries. I was speaking in several seminaries, and I teach. I gave lessons to some people, and now it's very complicated to me to do that because it's very difficult to deal with the stress, with the anxiety. I stopped traveling. Me and my husband, we are alone with this. My husband is very tired because he doesn't know how to deal with this kind of situation. Our friends support, but they don't realize what kind of this disease, because we are okay, but besides this, we cough, we feel tired, we have changed mood. Everything is complication for us, for me. And I learned what I learned I learned everything with you, as I said at the beginning, with NAC. To belong to National Aspergillosis Centre, or to the group, to the support group, it is very, very important for me from the beginning, because everything I know, I learn with all of you. I'm very, very grateful to you. I have very, very difficult days, and I send a message by Telegram, and someone answer me all the time. So I felt I'm not alone. I have answers. Sometimes doctors here in Portugal say, oh, it's your mind, you are depressed, you need to go to a psychiatrist. No, this is the disease, and this is the prednisone, the drug, doing this. And now I know that it's not my mind. So I'm very, very grateful, because I know everything, every studies I have came from you. As everybody say in the group, oh, you are okay. For example, I go out, I go to the restaurant, I go take a coffee. In Portugal, we go out for take a coffee. So oh, you are amazing, you are okay, but are you, you are much better, you are not diseased. Well, I don't, sometimes I'm fed up, sorry, to explain something and decide not to speak about the disease, and I go and MR. But I know how I feel today, and I know the person how I were before to have ABPA. It's very different person. I'm a very different person. My husband is my support because he is lawyer too. So here at office, sometimes he solves all the problems because sometimes it's impossible to talk, to be under stress. The stress normal of life, the normal stress of work, the normal stress of our job, and sometimes he necessarily make things, deal things, have meetings with the clients because I don't feel very well, because I lost my voice, because I shake too much, and some clients understand. Sometimes some clients support me, wait until I feel better. But as you know, another clients need their soul. I solve their problems. So sometimes it is my husband go to solve the problem. So he's my support all the time. But he's too tired because our life is this. It's important to have a group to speak about this, to support this. For example, I look my husband, every time I cough, my husband said, oh my God, she's coughing again. Do you feel okay? For example, things like um, when I done itraconazole and voriconazole, I discovered by myself that was very it was necessary to put not have sunshine, so put protect. I discovered by myself. Nobody said to me. Everything I know of the side effects of prednisone. Yes, we know the swollen face and to get weight, but nobody knows anything more. So, for example, if I go to a dentist, it's very important to say I'm taking prednisone. Nobody said to me besides you. For example, when I take voriconazole, it was necessary go to make painting my hair. So I asked to the doctor, and he said, no, it's not very good idea. So things like that, it's very important. Painting your hair, for example, makeup. This moment, my face is burning all the time. I can't touch in my face. So it's impossible to make a makeup. That is important for our for us to be to be well. It's of our to be you feel well. So nobody speak about that. For example, if you get weight, what I can do, what I can eat, what kind of food, what I can diet. I ask. Nobody explain me. So I'm look every day. I make research every day when I came to office, and I make a pause when I'm very tired, and I go to Google, and well, what we have news from Aspergillosis, or in Portuguese or in English, or I go to see your Facebook, or every day I make research every day. So my life all the time around the disease. So my mind never, never, never rest. So it's very hard. And when I feel desesperated with the prednisone, and every day I feel better. In the morning, I feel better. After lunchtime, oh my God, prednisone like explode inside of me, and I felt very well. I felt I'm falling down. So I stopped do everything because I don't feel well anyway. I feel very anxious. My heart is it's awful, awful. So what I can do, I shake all the time. I have tremor all the time. So I try to make different things. Now I try to, okay, I go out, I Google things because sometimes I feel so confused because it's impossible to think. My days, I have two parts of the days. In the morning, at the moment, in the morning, I feel better. I can speak, I can do things, but I can think slowly, not under stress. It's possible to have 2 or 3 appointments at the same time. Like for example, before I have ABPA, I have 3 or 4 things in the morning. Now I have 2. I'm okay. I'm taking the prednisone in the morning. Now it was supposed doing 15 milligrams of prednisone. I'm trying to by myself get the balance between 15 or 10 milligrams to understand which is better. I make a diary of that. I make a diary since from the beginning. That is very important. That's one thing I learned with you, but I do the diary before, because I learned that with the asthma, with the pneumologist when I start to have asthma. So I make the diary because of the symptoms, the time I take the drug, and the symptoms I have during after lunchtime. So when I take the prednisone in the morning, 5 hours, 4 hours after, I felt very depressed, very anxious. I felt lack of strength. I felt very. I felt tremors. I felt. I felt sometimes I felt pains in my legs, and that of course affects my quality of life because I need to stop everything I'm doing. So I sweat all the time. So I stop. And I decide to make different things. Sometimes I feel better. 2 hours, 3 hours after, more or less 5 p.m. I feel better, and I start to do my things. Another day I don't feel. I feel very tired. I have I have pains, so I need to stop. For example, when I start with 20 milligrams of prednisone, I felt these side effects. These side effects were too strong. When I get a small dosage, for example, 5 milligrams, I don't feel these side effects. I felt my face red, I shake my hands, but I can't speak. I don't feel so tired. I have not so many pains. So it depends of the dosage of the dose of the prednisone. With ABPA, what's happened? If I have a relapse, I cough all the time. I have mucus and I have wheezing, and of course, I feel tired all the time. But if I have not a relapse, the problem with me, it is the prednisone. At this moment, I'm okay. I think I'm okay. But the results of the analysis, the EGAs are above 5,000. So that's why my doctor decided to give me 20 milligrams of prednisone. But that is awful because I don't get ill because of BPA, but I get ill because of the prednisone. So where is the balance here? That is a big question. As I explained to you, I have a busy life, but I not only working, but doing things I like to do. For example, I like make things, painting, or make things with my hands. But small things, it's impossible to do because I'm shaking all the time. That is quite frustrated. Or, for example, sometimes I lose my mind, I'm confused. And sometimes I want to say one thing and I say another thing. Sometimes I'm very slowly to think. I lost my focus. And it's important in my profession, it's important to decide things at that time for that client. And sometimes I feel I'm not fulfilling the thing, the aim. I'm not feel I'm it's very difficult to decide because my mind it is confused. That was I asked my husband support, and we discussed all the time things. For example, I'm sometimes I'm typing things on the computer. When I read again, it's oh my goodness. But so things I do every day, I do things, and I'm in front of mistakes that I do today, and I never done before. And sometimes I say, okay, never mind, don't. For example, I'm in the group. I say that I see this in the group. Sometimes people, we don't remember dates, we don't remember numbers. That's happened very. It's often happen because we don't remember things. That's why I have a diary, because sometimes I don't remember. In my clients' files, I write everything. I make a diary for each client because it's complicated to remember things. When a story that's happened in 2023, when I have a relapse, I was taking itraconazole and I was taking prednisone high dosage. I was driving. I lost myself. I don't know where I was. So yeah, it was a place. I know I went there several times. So I was driving alone, and I only remember it is turn on left. But I don't know where I am, where I was. So I say to me, don't get in panic, don't get in panic, because that is because of the drugs. So take calm, take calm. And I make relaxations. I was driving and try to make relaxations exercise to be calm. And fortunately, when I stop on a road, I said, well, I know when I am. So that is affect the quality of life. It's very important to get the balance between all of this, to have quality of life and to do the drug. I'm learning every day. I'm learning to establish priorities and the priorities of the priorities. I continue to practice pilates. I practice yoga. I practice swimming pool. Every time it's possible, I try to do my best. Every time I go to the cinema, I go out, but I can't do things like, well, next month I go to the theater. I don't know, because I don't know how I feel. I can't have plans. That is complicated for me. I can't have sometimes dreams, because I don't know how we feel next month. And that is quite complicated for me and my husband, because we travel abroad and sometimes we schedule or we make an appointments for holidays abroad, and we don't know if I feel better or not, because I don't know where I can go and how I will feel. So I'm learning live with ABPA. I really realized it is a very long road. The great question it is, what affects your quality of life? It is the drugs you are taking for the disease. It is the disease affect your quality of life. So we never know which is which. So that's we need a support, and that's we need to speak with different people with different passions, sharing our fears, sharing our limitations, find different hobbies, find different quality of life. And of course, we are not alone. We have we have our families, and our families don't know how to deal with this kind of disease. For example, in the group, she say all the time, oh, you get cancer. Oh my goodness, you have cancer. Everybody's try to support you. If you say you have aspergillosis, oh, what is that? Because here in Portugal, we don't know anything about the disease. So everything I know, it is through NEC. It was very important to have a similar support group in Portugal, because here I don't know how many people are with ABPA or aspergillosis in general. I don't know. I don't know how they treat. I don't know who are the numbers. And when I ask to the doctors, it seems they have no answers. I say all the time, in Portugal, I think it's not a rare disease. I think people have not the correct diagnosis, I think. Because it's impossible. Here in Portugal, we have 1 or 2 or 3 cases. It's amazing. we don't have a really study about that. I think I have a big one here, shell one. I go to the sea and pick all of them. I never painting them because sometimes I prefer here by the nectar, and I send them again to the sea. But for example, I have another here. I don't know if you can see it. So I put a candle here, and I put here. So, but
Right.
I print. I take photos. I take photos from the shells. I share sometimes in the group, and I'm printing the photos in, for example, in bags, or I ask someone to print my photos because I love photography. So I take photos. I go out. I take photos from shells, from flowers, and I print in small bags, or I haven't here anyone, and I'm printing, and sometimes I offer to my friends. So that's one thing I do. Another thing, try to do rings or things with the shells. So that's things I can do because it's not similar things. Another day I think I thought to go to painting, but it's not good idea because I will feel frustrated because my hands. But I try to do things. I read. I listen music. I listen meditations too.
Yeah.
I try to every time I try to get to go out with friends when I can, and I practice sports. Sometimes it's not easy, but I go anyway. But I try to make my health, my mental health, good. But sometimes it's not very good because, as I can say, I'm all the time make research. I believe uh, I believe that will be better. I believe uh, there are many people working to discover more things about this kind of disease. But every day, every day it is a challenge. It's quite difficult, but what I can say to the other patients, I can say the same thing to say to me when I enter in the group, in support group. Prioritize things, make a list, try to do our best every day, be grateful all the time. Don't stop. Try to understand the disease. Try to learn everything about the disease. It's very, very important, because if you have knowledge about the disease, you can ask to the doctors. That is the main subject. And what more? Be patient with us all the time. Speak to our family, and try to get the balance between the drugs and the quality of life. That's I'm looking for that at the moment to other people, and to say thank you to your support, to Alison, Graham, Lauren, Mick. Every day I see Mick, Evelyn, everybody. For me, they belong to me. And thank you so much.